Well, good morning and welcome to the Total Health Pros Q&A. This is our very first live YouTube/podcast. So welcome, I'm Dr. Darren Vanskoy. This is my partner, Lori, and we're very glad you're here. We're discussing some fun topics today. In fact, we've had a lot of questions come in about libido. So it's something that we see a good bit in our office. When you say, Lori?
Yes, we do.
Yeah.
Every day.
Every day.
Numerous times a day.
So we've had some questions come in about libido in regards to health and wellness and fitness. So we'll be discussing those. And during the same time, please, if you have questions during this live, put it in here and we'll answer those as best we can. And as always, if we don't know the question, we'll get back to you. So please participate. If you've got questions, put them in there. We've got somebody that can read the questions back to us. So we're ready to take off. All right. Lori, you want to go over the first question?
All right, I'm going to ask you, Darren,
Okay.
since you're a gentleman.
Okay.
What's normal libido? Annette from Parkersburg has already sent in that question.
So, there is no real normal libido, I would say. It's so variable from male to female, male to male, female to female. It's one of those things that, it's very individualized. There is no right or wrong with this. It's going to be, and remember, libido that we're talking about is really the mental picture of intimacy, right? It's the mental picture of desire. It's not the actual physical aspect that we're talking about. And so libido can be affected by numerous types of things. So, I mean, it can be affected by stress, by personal issues, can be affected by medications. A lower libido is not always a hormonal imbalance. And that's the thing that we've got to remember is the fact that, that a lot of these systems interact individually. And so, but there isn't any normal libido level per se. What I would say would be normal is that the fact is if you desire or you want to have intimacy with someone, but yet that part of that mental picture isn't there, that's the problem, right? I would say that that's the issue because really, honestly, when it comes down to it, there's going to be people that have a libido that have that mental picture, that mental desire for intimacy, maybe daily, maybe weekly, maybe monthly, maybe less than that, maybe more. It's hard to tell. But the thing is, it's just when you know that you would like to have that and it's not there, then that's when it's a problem. That's why I'd say that's when you need to look for treatment.
As Darren was speaking, that's happens with a lot of us that are really in high stress jobs or we work many hours a day. A lot of times that you want that intimacy, you want to be with your partner, but the stress of the day, I've confided that with Darren when I've talked about my own libido, when we've talked about things with customers in front of us. It hits me when I'm alone, when I'm at home by myself, when I'm there and all of a sudden I'm like, oh my gosh, and my husband's at work, and as Darren has said, it's because I'm not stressed at that moment. I'm actually not involved in 3 or 4 different things at once. Yeah. I'm relaxed and those thoughts and that process goes into effect. It's not that we don't have it. A lot of times the stress levels, things like that, just constantly going as mothers, as we are constantly taking care of children, doing our own job, taking care of the home, cooking, cleaning the clothes. These things get in the way of it because we don't stop.
Women's minds never stop, right?
That's our problem.
Right? And I would agree with that. There's definitely a bigger difference in libido from men to women because men can become so focused, like tunnel vision focused on one thing very easily. But, I would say that women, there's just so many complicating factors. Yes. I mean, they seem like they want to be mother first, work, all these other things that they think about. And they can't get that out of their head a lot of times to just relax. And again, have that mental picture that we're talking about, that mental desire for intimacy. So I think that's one of those things that there is no normal level, but if it interferes or the lack of it interferes with your relationship, that's Absolutely. When you probably need to make some medical advice for it. So another question that we've got, Mark from Charleston, if a man has erectile issues, i.e. ED, is it always a testosterone problem?
That's a great question because some of you may not know, I'm a nurse practitioner and I came from cardiology, electrophysiology. So even in my nursing career prior to becoming a nurse practitioner, I worked in cardiology. And I actually, with one of the representatives that came in the office for Cialis, those Viagra, came in and said, I have a questionnaire. Would you ask the gentleman in your office these questions every time you come in? So this is very long ago in my career. And I started asking those guys when they came in if they had issues with, erectile dysfunction, because I'm in a cardiology office.
And people don't associate that with
anything.
Yeah.
However, what's going on in your heart when you have coronary disease? You have plaque buildup, you have blockages in your arteries. What does that do? It decreases the circulation of blood to the heart. So then you have chest pain issues. It's not just in your heart. It's in every vessel in your body. So sometimes erectile dysfunction can actually be the first sign of coronary disease, and this is something that's overlooked a lot. So definitely, when men come in the office, I look at their past medical history, their family history. If there's nothing in their family for coronary disease and they're just having libido issues, it's probably going to be low testosterone. It's going to be things like that, or just other things going on in their life. But that's definitely not the only reason. And trust me, it gets worked up in when we see them, because if there's an issue, we're going to look in deep into that and make sure it's not something other than just testosterone or hormonal levels, because we want to get you to the road to the right place to be to get taken care
Well, I
of.
mean, already in the office, what in the last
Oh,
year, we've
my
probably
God.
a year, we probably had 3 or 4 patients coming in,
Yes.
and men,
Hmm.
you have fatigue, lower libido, right? And actually
Hmm.
performance issues that was their main concern
Hmm.
ended up being major cardiac issues
A
for them.
couple, a couple have been
Yeah.
stented. They've one had the Widowmaker 99% blocked and had no clue. So these are things that's one good thing with me being with Darren, because of my background. This does help us evaluate these patients very closely,
Thoroughly. Yeah.
thoroughly. Yes.
Yeah. And so that's one of those things. So don't just take it for granted,
No.
especially if you're a guy with ED issues, that it's just a hormonal imbalance. There's so many other things that it could be, but it's one of those things. The big event that it could be was the cardiac risk factor with it.
Correct.
So it's one of those things. If it's there, get it checked out. Right. Okay.
All right. Let's see. Okay, Darren, is it normal for a person's libido to fluctuate up and down? That's Parker from Charleston, West Virginia.
Yeah, it's completely normal, both male and female, for that to occur. Again, as we kind of previously discussed, there's just so many things that flow into that. Whether it be medications can be a major factor. They can be over-the-counter medications. They can be, prescribed medications. They can have a significant impact on libido. The other things that could, other health and personal issues, right? Stress, fatigue, issues with personal relationships can definitely have an affect on it. The other thing then that we can look at is other health issues. Hypothyroidism is a big issue with people with libido problems. The other things, anemias can cause it, because of fatigue, being tired. Kidney disease, kidney disease has so many affects on so many systems that could cause libido issues. So, outside the scope of the issues that we're talking about, it's still very normal, because people's feelings go up and down, our energy levels go up and down. So again, there is no set, correct libido, and it's perfectly normal for it to fluctuate. What's not normal is for it to not be there at all, or for you want it to be there and it's not.
And it's not there.
And that's when we say, listen, you really need to get it checked out, right? Whether it be, with a functional medicine practice like ours, whether it be at your urologist, it's definitely something to have it looked into.
And just on a normal phase for a woman, we have our hormonal levels go up and down, and they fluctuate through the cycle.
Completely.
And
Yes.
when you get to the middle of the cycle, that's when you're going to ovulate. And normally our estrogen levels are going to be higher, and that's when we're going to be heightened with sexual desire.
Well, and testosterone.
And testosterone, they both
and
come up.
estrogen follow
Yeah.
up. Yeah.
They both come up. And if you're premenopausal, it's definitely got the estrogen is going to be one of the main players for
Yes.
sure, and testosterone. And that's because that's when we're supposed to procreate, have babies. And there's been numerous studies done that show that's definitely the time when the woman has the highest libido. However, when it comes to sexual intercourse, sometimes it's not as high as you would think it would be, because many of those women, including myself, when I was in childbearing years, oh my gosh, my birth control method is not good at this time, so I can't go
Right.
into it. So the sex may not happen as much then, but the desire is definitely higher during that time because of the hormone levels being higher.
Women are just complicated.
Very complicated. It's not an easy path to
Women
treat.
are basically 3 different critters throughout the month. Literally, it's tough, and so especially navigating that as a woman can be very
It's
difficult
tough.
when we're talking about libido issues, because there is such a changeover in hormones from the beginning of the month to the end of the month. Mid-cycle, definitely, when the body's preparing for ovulation, testosterone's peaking, estrogens are peaking. Women are like, yes, I'm ready to, be able to procreate. So that desire is it's just naturally built in there. And so, that will make a big difference. But without a doubt, it is very normal for it to fluctuate, especially with women, right?
We are
So,
difficult.
yeah,
Sorry.
yeah, it can be very difficult with it. So another question, Paul from Clendenin said, I read that diet can affect your libido and sex drive. Is that true?
I'm going to let Darren take this one first because he's the diet king. I have to give him credit for that.
Well, I'm going to say, Paul, 100%, right? So and what I see all the time, we see coming in our office, guys that have been on high protein, very low fat, low carbohydrate diets. And they're like, listen, I feel great, but I don't understand because my libido's in the tank, right? And it's primarily diet driven. The fact is, I mean, fats are extremely important. Cholesterol is extremely important in hormonal modulation. So if you've got a very low fat diet, you're not going to have the support for hormones and for hormonal creation, hormonal balancing. It's just not going to be there. So your libido and that drive, that mental picture again of intimacy and sex is going to drop significantly because you can't balance your hormones out. You can't even really produce testosterone in the right amount. So it makes a massive difference. So, when we're talking about diet affecting it, low fat diets are the
That's the
ruination
definite.
of hormones, right? And I mean, I work with several men's groups where we're working on getting these guys super shredded. It's difficult because we want to get them. They want to get really lean. They want to look great, but then we've got to watch testosterone levels and
Yes.
balance those because they can flatline. And all of a sudden they're like,
Mhm.
man, I've got no energy. I've got no fatigue. I don't really have any desire for my wife. I'm not really, got any zest. And all of a sudden it's like, okay, listen, we know your testosterone's bottomed out, So we make sure that when we're monitoring, we really go by macro diet, that we incorporate a good bit of fat still into these guys' diets. And we monitor that. So, protein, again, another one, extremely important in regards to libido. So diet has a massive affect on libido. The other part of that is high carbohydrate, high sugar diet, right?
Yeah.
No good fats, no proteins, going to kill libido,
Kill
right?
it. All you want to do is
Obesity,
sleep.
yeah, obesity is a hormonal killer, right? For men, women, both. And so, diet has a massive impact, probably the biggest impact of all things that we will discuss today. Diet could probably be right up there with all of those in regards to its positive or negative affect on libido.
We've seen that even with younger gentlemen, I mean,
Yes.
below 20 coming in, their trainer sends them to us to, either that their testosterone is low. Well, they've been on a fixed Fred to lose all this weight because they've been heavy, and then they have absolutely no because they have no fat.
Yeah, we
They
have a
don't
19-year-old.
Yeah, 19-year-old, and his testosterone was, gosh, maybe 190, and
If
then
that.
if that. And, we did not put this client on, testosterone therapy
Too
because
young.
he's too young. So Darren increased his fats, comes back in 4 weeks, he's already bumped up 200 points or more on his
Yeah, it was more
testosterone.
than it tripled what it was.
Yeah,
Actually, I think is
it
really
did,
what it
because he
came
was
down
lower
to.
than 190, he was extremely low. I mean,
Yeah.
and the kid, I mean, he just couldn't understand it, and it's that low fat diet, and we've all been guilty. In years past, I was just low fat. I ate no fat, absolutely no fat in my diet pretty
Mhm.
much. I mean, yes, I got thin, but that's just not healthy. We have to have it for all hormones. So, just keep that in mind.
Unbelievably important. So, yeah, diet plays a big part in it. If you've got questions about that, again, text us, call us, reach out to us at Total Health Pros on
Absolutely.
Instagram, Ascend Elite Health on Facebook. Okay. Question here, Sissy from Mineral Wells. Can taking supplements alone help with libido, Lori?
Actually, yes, it can. We all, like I said, as we
Absolutely.
get older, our hormones, our levels change. Our ovaries, it's important for us as women. The ovaries, they start to die down. They start, the eggs, we've gotten rid of all the eggs. So estrogen levels are going to come down, and that's what comes from the ovary. The adrenals basically put out the androgens. So as we go, we have this decrease in levels, but we can actually add pro hormones in there. There, ashwagandha, ginseng. That's another type. It's a type of ashwagandha is a type of ginseng actually. So these things, as well as zinc, vitamin C.
There's a lot.
There's lots. There's over 30 or more supplements you can add. Now, basically, I think putting these in conjunction with each other are good because I take numerous supplements in a day. But two that we look at in the office, we look at pregnenolone and also DHEA.
Yes.
These are things that we supplement daily. Literally, we see hardly anyone with a pregnenolone level that's where it's supposed
Anywhere
to be.
close to where it should
And
be.
this is crucial for progesterone for women as well as other hormones. So we look at those levels, and that can be, it's an easy fix. I mean, if you can take an easy fix, it's a supplement to increase these levels to be pro hormones and increase your actual endogenous hormone levels, why not? We do try to go that route a lot of
Yes.
times. We get
First,
people
if we
in
can.
first.
Yeah.
We get people in with everything low. Their thyroid's low, their estrogen is low, their when they have is low. So we don't want to just throw in medication or hormone replacement at that point yet, unless it's just absolutely null. So we try to add the supplements in first place and then go from there and monitor the
Yeah,
patient
and it's
closely.
complicated because, like we've talked about
Very.
here, there's so many things that can cause lower libido, right?
Mhm.
And so when we're looking at it systematically, when we're looking at the actual overview of systems and processes within the body, sometimes you can have 2 or 3 systems that can be,
Mhm.
be the culmination of this lowered libido. So, sometimes we're doing a lot of supplements with patients to address those issues. And we've seen some major significant
Absolutely.
increases without having to put them on, any type of hormone replacement therapy, hormonal therapy, whatever. And they've done very well. And so, but what it comes down to, you've got to diagnose those systems and those issues that aren't working correctly have got to be diagnosed properly with blood work. And we do a lot of blood work to address a lot of these issues, because even things like vitamin D being low,
Absolutely.
vitamin B, simple things that are easy fixes, can a lot of times have a major effect on libido. Why is that? Fatigue, right? And that'll be something else we'll talk about here, I'm sure, because I mean, fatigue is a major driver for all things bad in our lives, right? But
Absolutely.
especially libido, sexual drive, is a big issue. And so, a lot of these that we look at are vitamin mineral deficiencies that, play into the energy level processing systems and those types of things too. So again, diagnosis, blood work is absolutely crucial, but supplements over the counter can absolutely have a major impact on libido in a positive way. And so it's one of those things, just speak with your doctor about it, contact us about it. Again, diagnosis, and then the correct blood work being done is going to be the big thing, the big part of that. So
I'll throw in here too, we're always stressed. We talk about stress, and cortisol is out there.
huge.
It wreaks havoc on your system. It actually binds to the site where your estrogen and testosterone, all these hormones are trying to get into the cell. So it's trying to get in there, and cortisol blocks that. So if your cortisol levels are out and through the roof, you're going to have issues. So we treat that daily. We have
Yeah, and
high,
we said, and if cortisol levels are in the
are
tank,
in the tank. That means you're
it's going to
exhausted.
be the same issue
Same
too.
issue.
So cortisol and the adrenals, and we see an adrenal burnout is huge.
It's
We
huge.
could
We're
do a
seeing
whole
it.
nother
Oh my gosh,
podcast /
absolutely.
YouTube live on adrenals and adrenal burnout, because stress, not sleeping enough, poor diet, right? High caffeine usage. And so the adrenals just are constantly pumping out, and they get burnt out,
You get
and then they quit
exhausted.
to function. So you go from the person, you'll see, 1 week that they'll have these high adrenal levels, their stress is spiking, and then, they'll be back 4 or 5 weeks later, and their adrenals have crashed. And it's literally because the organ systems themselves have quit working, right? They're just burnt out and they're tired. And so that cortisol, that stress level, can have a massive impact on libido, sexual
Mhm.
drive, and those types of things. Because one, I mean, it's actions, and then two, then it does absolutely, as Lori had mentioned, it can bind those receptor sites so that the hormones can actually get into the cell and take the action that they need to. So cortisol is a big issue
It's a
that we
big
look,
issue.
we look, that's a standard that we look at, male, female, it doesn't matter about age, whatever. We look at cortisol,
Absolutely.
adrenal function is a big thing that we address. And again, that's something easily addressed via supplementation,
And it's a
right?
sneaky factor. It goes up and down through the day. So you have,
Yeah.
there's some we just can't get right, and we'll look at a saliva level. But we try to do serum actually to keep our patients on the lower end of payment. But there's other ways we can look at that as well. But it's a sneaky little thing.
Yep,
It sneaks up
and
on you.
over-the-counter supplements typically are gonna be a little less expensive, than your hormonals. Of course, then you can stay more natural with it too. It's one of those things that
Absolutely.
once you fix those organ systems, ideally, then, that problem is addressed. Hopefully, everything normalizes again, and then that problem isn't present anymore. So, big picture, that's what we wanna do. We wanna address everything naturally as possible, fix the system so there isn't a problem. We really look at hormonal replacement as last line, right?
Yes.
And that being said, if levels are so low, then that's really is the last. That's the first line,
That's where we're
because there's
gonna
no
go.
other things. Yeah, sometimes over the counters just aren't going to work, but for the most part, supplements can have a massive difference in libido for sure. Let's see, Clacy from Oak Hill, what can cause lowered libido? It's kind of a question.
We've gone through kind of that,
Yeah, it's
all
kind
those
of yeah.
causes we've mentioned earlier previously. Let me make sure.
Yeah. And so, again, the biggest cause I would say more than likely, both men and women now, is fatigue and stress. Yeah, it's not always hormonal imbalance.
No,
Those will lead to hormonal imbalance, for sure, without a doubt. But I would say that fatigue and stress is the big issue, and probably the other thing, I mean, what you've got to take into account for women, right? You've got issues with, I mean, relationship issues, right?
Absolutely.
You've got perception of privacy, those types of things for
Mhm.
women. Guys maybe don't care quite so much, it doesn't seem. But, there's just a lot of issues there. But, definitely, lower libido, by far the biggest issue we see is probably fatigue. And I would say, it's probably fatigue and stress. I mean, by far.
I'm actually reading a book right now where I use the Audible books because I can't read. I fall asleep. I'm one of those people constantly going as well as Darren. And it's some therapy for women. They actually sat down and said, listen, you need to focus on your libido, your orgasm, more times a week. Your job is to have an orgasm 3 to 5 times a week for the next 6 weeks. And I don't care how you have to work with your partner, take care of this. And their actual attitudes or their behavior and how they felt about themselves improved. They came back in a totally different person. They took time for that. And that's hard, just taking the time for it and setting
Yes.
everything aside. And we're doing all we can to get you there hormonally, physically, those ways that we can help with. But it does take setting aside those things. I'm putting this down for a moment. We're
Absolutely.
scheduling a date. We're going to do a date at 6 p.m. on Thursday. We're going to dinner. We're going to have the time we're alone. The kids are going to your parents. The kids are going to the sitter. That's important because if we don't take time for that, our relationships are not going to continue to cultivate. It's going to go downhill. So
It's a huge part of relationship.
Huge.
Yeah, huge part of relationship. Just got a text in from Sarah from Ripley. My friend had serious issues with her libido and physically responding to intimacy. Her doctor started her on testosterone. I have some of the same issues, but I am fearful of developing male characteristics. Does this always happen with women on testosterone? Let you take the lead on that one.
well, it doesn't always happen.
True, absolutely.
As we get older, women do get more hair. I mean, we get hair on our chin.
Guys do too. Ear hair, everything else, right?
Nose
It
hair for the men.
happens. It happens.
It happens. But I think it doesn't always happen like that. We have to have a good balance in all your hormone levels. You have to have a good estrogen level, testosterone level. But we try to look at an area that puts you in a good spot, but not over the spike. I'll be honest with you. For me, my last level, my testosterone was 70, and my free testosterone was, I think, 4.7. That for me, that's a perfect range for a woman at my age. I mean, I'm going to be 60 this month. I don't want to lose my hormones. I want to protect myself cardiac wise with estrogen, but we also see these people that do have some of these characteristics. And actually they've had them before they've got to this age because they have a higher testosterone level normally. And then there are some that have high testosterone level, and you would think they would have that type of situation with more hair. They don't. It's just the body reacts differently to testosterone in some
It's
people.
very individualized
Mhm.
for sure. And, from our perspective, we don't want to change anybody's
No,
physical,
we do
nor do
not.
we believe that should, I think the misnomer is that women see all these women bodybuilders, right,
And
that
that
are
are
on testosterone,
taking high levels of
high
testosterone.
levels and, much higher levels than we would ever recommend. And so you see the voice deepening, you see the
Mhm.
jawline becoming more narrow.
Square, yeah,
Yeah,
square
you
hair,
you see
yeah,
the more
more male.
male characteristics, being presented. But again, these are women that are on way above therapeutic doses
More than
for
what
women.
Darren takes a week.
Yeah, more than some of these women literally take more than I do. And so, that is not healthy. We don't recommend it. Athletes are going to do what they're going to do to compete, and when you look at athletes at the elite level, right? They
Yes.
do some things because they have to be on that stage and be
Mhm.
competitive. But that's not what we're talking about
No,
here.
this
We're
is
talking about normal women.
everyday life to
Normal
function.
women
Mhm.
with testosterone supplementation, with monitoring the blood regularly, like we do, like
Mhm.
every 4 weeks, like literally until we get you stable, till we know there's no problems, till we see that you're doing better,
Mhm.
you feel better, we've addressed the issues that you have. We are monitoring your blood work and we are keeping you as low as possible. Seldom, if ever, have we had a woman come in and say, "Listen, I'm not comfortable because of, I feel
Oh,
like my
absolutely.
voice." Now we see it all the time. Women coming in
When they
that have
come in and have
been
have health.
overprescribed by
Yes.
other providers, or that they're actually injecting testosterone and it's just too much. We do see that they're having some physical symptoms that they're very uncomfortable with. They're
Mhm.
uncomfortable, they notice that their voice getting deeper,
Mhm.
but again, that's because they're being overprescribed and not monitored correctly. So, women on any hormonal management replacement, if the monitoring is being done, you're not going to see negative
No.
affects. You're only going to see the positives from that. Positives being increase in focus, right? Less brain fog, definitely increases in libido, sex drive, increases in all of these things that
And
really
also,
make you able
if you
for
have, a little bit of
belly
loss,
pooch fat. Yep.
pooch fat can go away because lower testosterone can cause that.
Yeah,
Levels can cause
absolutely.
that.
And so, those are the things. So really, testosterone supplementation for women isn't negative at all when it's done
Absolutely.
correctly, right? And there's so many options out there now. I mean, we've got women coming in because they're being told and being prescribed injections. They hate it, right? I mean,
Mhm.
injections do work.
It
You can
doesn't
do
have right. You can
sub-Q.
do subcutaneous
Yeah, they
injections
can
the
work,
same
but
amount, but
creams work.
they don't
Yeah,
want to do that
yeah.
injection. So we most of the time we use a bioidentical hormone
Yep.
cream. Um, and if someone wants to do most of them that have come, they don't want that. That's why they come. And the implantation of pellets. A lot of women. That's when we've seen a lot of women come in with like really high levels of
And
testosterone,
negative affects
and
from
they've
those.
come in and been very, very concerned. I have an example. One patient did that. I've got her testosterone actually is a little lower than where it probably should be, but now that she's gotten those levels down, and we've got her thyroid fixed, she says, "Lori, I feel better than I did before I started those pellets."
When it was really high.
Yeah, when it was really high. So she said, again, she was beginning to have those characteristics she was very uncomfortable with. So sometimes it's not just that testosterone level. And if you're not looking at the blood work and looking at other levels, you could be treating just one thing, and there's others going on that need to be corrected. So that's
Absolutely. Yeah.
definitely
So, if your doctor suggests testosterone is nothing to be scared of.
no,
And I mean, we see it when the women respond unbelievably well. Again, you don't have to do injections. You can do troches, which is like a little
absolutely.
kind of dissolving type of like gummy that you put inside your mouth. It dissolves. There's vaginal creams.
Yes,
There's
vaginal.
suppositories. There's, just on the skin creams that, transdermally absorb. There's so many options for women now.
Mhm.
It's definitely something to pursue if you think you need it. Talk to a functional medicine provider, give us a call, talk to us, consult with us, no problem there. But it's definitely not going to happen if it's managed correctly, right? And,
Correct.
and you're dosed correctly. So, Jan from Huntington, I've recently lost a good amount of weight. I look better and feel better, but my libido has gone in the tank. Any suggestions on issues that I could address?
I would say there that might be the fat loss or low fat
Yes.
diet situation going on because, we do cut back fat. When I'm going to cut weight, I cut fat back. So that could be part of that issue. And again, getting those hormones checked because she's changed her whole body habitus. Everything's different. So we definitely need to get blood work and look at that client and see where she stands on her current levels as well as
Well, there's a lot we don't know here. Like we
right.
don't know
We
what
don't
the
this
caloric
is kind
level
of out.
is.
Right.
Yeah,
We
we
don't
don't
know
know
what
what the
she's
caloric
doing.
level is.
Uh-huh.
If your calories are way too low,
If she's exhausted
you're
because
going to
of
be
that.
tired.
Yeah.
You're going to have lack of energy. So yeah, your libido is going to drop. If you
Yeah.
don't have enough protein and you don't have enough fat in the diet, good fats in the diet, yeah, your libido could drop.
Mhm.
And a lot of times too, that's what we see, especially women on these crash diets. I mean, we
Oh
see this
yeah.
so many, like women maybe eating one time a day,
That's all they eat.
super small amounts of food. We're not talking about intermittent fasting. We're talking about like in one day they have a package of crackers and like a bowl of soup. I mean, like literally something insignificant when you look at caloric level. And what's happened is
Absolutely.
their metabolism, everything is just
Shot.
completely shut down. And so, depending on how you've lost the weight, Jan, and what you've done to get there, that alone could be the issue. It's just the
Mhm.
weight loss because of the low calories, right? Again, you could run them into some hormonal balance because of the lack of fat. We need more information on that, but be one of those ones. Definitely give us a call, follow up with us at the office, hit us up on totalhealthpros@gmail.com, whatever. Send us an email. Any way you can reach out and let us know. We'd be glad to help you. Anonymous, I'm just too tired to worry about libido. I know that's not normal. If my free time, I'd just rather sleep. Please help.
I literally had a lady come in to tell me all she wanted to do was
Almost
take she said
verbatim.
I said,
Yeah.
"What would you do today if you could do anything you wanted? What would it be?" She said, I'd take a nap." I had another one yesterday the same way.
Yeah.
They just want to sleep. And again, um, I understand the situation when you're in this point of time with that your hormones are out of whack, I'll say, and you're just exhausted from work. I mean, this is what you want to do,
For
but
whatever
definitely, I
reason.
know
Yeah.
you're saying, please help. Definitely. This is what we love to do for people. I mean, nothing is more rewarding. I've had the sickest of the sick people. I've said this before, working in cardiology. And trust me, I use this every day in my practice with Darren, with my cardiology side. But I have never been more fulfilled in what I do than now because these people come in just like you, whoever you are out there, anonymous, every single day. And to see them come in and be happy that they have abnormal lab work from the lab that we ordered
Because they've
because
got
they
a plan. They've
finally
got a direction.
have a direction
Huge.
and we can send them that direction. So, please come and see us. Give us a call, give us a text. My number is 681-781-9005 and
382, 382, 382,
304.
304, 380, 332. It's there, right? We've got it out.
It's there.
Yeah.
But text us. We love to chat with you. So.
Yeah. And so, the thing about that is too, that is something that definitely needs to be addressed, right? If you're just too tired, that means you've got some major fatigue issues, right?
There's reasons.
And there's a lot of reasons that could be going on there. And blood work's going to be a key. Blood work, tracking your diet, right, is going to be a key. Looking at your calories, your fats, your proteins. But this is not normal, when you're just that tired. So it's definitely, you can have multiple systems going on.
Absolutely.
And I would say that probably libido is probably not your main concern here, but it's just a side effect that you're seeing that's noticeable. Because if you're that tired, we've got a lot of issues that we could look at and go with.
I've got an example for that. Had a guy came in just the other day. He's never really gone to a regular doctor. He does not really want to see an allopathic
Not at all.
medicine.
Yeah.
He comes in and the first initial time he was having every fourth beat was a premature ventricular contraction from the bottom part of his heart. I was very concerned being from cardiology. I wanted to send him to cardiology right now. No, I don't want to go. I said, well, we're going to monitor your lab work and look at that. He comes back in the other evening to just go over lab work. And he says, I am just so tired. So I'd already listened to him previously, but because I knew that I listened, he was in atrial fibrillation most likely because his heart was so erratic. I said, you've got to
It was
go
all over the
now.
place. Yeah.
You've got to go. This is why you're fatigued. Yes, there's issues with your lab work. It's not the priority now. We sent him out to the emergency room, and he's going to be referred to cardiology. So you see, there's other reasons that can be underlying. So don't ignore those. Don't ignore fatigue. I mean, there's a lot of post-COVID issues with people. Their heart is not functioning
Absolutely.
appropriately. These things need to be evaluated. Don't ever just shrug off, well, it's just normal. They say I'm getting older. I'm just tired. No, do not take that as an answer. If you can't find a reason with your regular, normal lab work that's being done, there's deeper lab work that can be done. Please come see us. Come see some functional medicine person that can actually evaluate you further.
Yeah, and we kind of define fatigue as the issue. I mean, if you can't focus, if you're
Oh,
struggling to
absolutely.
focus, right, or you're falling asleep, or it's just one of those things like the mid-afternoon doldrum where, man,
Mhm.
2 to 3 o'clock in the afternoon, you're crushed with fatigue, like being actually tired and it's hard to function. That's what we're saying about fatigue. Now, it's normal, right? A really stressful day. You've had
Yeah,
super high activity.
yes.
You got up super early. You get to be at 9 o'clock at night and you're tired, right? That's tired. And that's not really affecting function during the normal
Mhm.
day of life, right? Fatigue is what we're talking about. Was literally you have a hard time focusing, like you just don't feel like
Don't even
interacting with
get
other
up.
people. Like
Mhm.
if you have young children, you're like, I just can't, I don't want to play with them.
Mhm.
That's what we're talking about with fatigue, and that's completely abnormal. And that is not something that should be shrugged off. It's not, hey, you're over 40, it's normal. It's not, right?
Mhm.
You should
Exactly.
have the energy to do whatever you want to do in your life and complete those tasks, be able to focus, enjoy life, be happy, right? And not limiting yourself because you're tired. That's the kind of when we're talking about fatigue, and that plays into so many different
So many
things,
different things.
and that can be driven by thyroid issues, that can be driven by metabolism issues
Mhm.
that are just genetic, that can be driven by diet. There's so many things that can go into that, but it's something that definitely needs to be checked out. Is it something that's going to absolutely have an effect on your libido? You better believe it is
Absolutely.
across the board. But again, that's what we said. So, low libido can be normal as long as it's not something that you desire to be there and it's not, right? When that's the case, you need to get that checked out. Fatigue is something no matter what, if you're just that tired, right, all the time, unrelenting, and literally, if you have a choice to do anything, you say, I want to sleep, which we've seen that a
Mhm.
couple times already. That's a problem that needs to be addressed. So it's definitely one of those things you'd want to contact us, see us. My number is 304-382-2080. As I went dyslexic ADHD there for a moment, but give us a call. And again, Lori, 681-781-9005. Hit us up, totalhealthpros@gmail.com. We're on Facebook, we're on Instagram. We're here for you. We want to help you, right? And
Absolutely.
so don't hesitate to reach out and ask us these questions. This is one of those things that's kind of a fun topic, but it's very in depth, really, especially again, women and libido is extremely complicated. My heart goes out because my wife stayed home for all those years, with our 4 children, stressed to the max, right?
Mhm.
And so I got to go to work, leave the house, go to work, right, do my job, come back, be at the house, which was my home. She never left work. She
Right.
got
She
up,
was
was at
there
work. Yeah,
24/7.
she got up, she was at work. She worked with the kids, throughout the day. I come home, she's still at work, right? The kids are
Mhm.
still there and anything. So it wasn't a break for her, a break from work for her ever, right? And so those are the kinds of things that you're going to see libido is going to be low, right? And that's when guys, need to try to step up and help out. If it's an issue in a relationship, address those issues, talk to your wives about those types of things. But again, that's something still that needs to be addressed because that's a stress issue, right? That's a fatigue issue. That's a tired issue. Come in and talk to us. There's definitely all kinds of options. And so, and genetically, we've seen people that are just low, period.
They're just low.
There is
Yeah.
nothing wrong. They are just, for females, big sex drive issues are going to be estrogen, testosterone.
Mhm.
Progesterones, you're like, "Ah, life's good, laid back kind
That's
of thing."
right.
And so, that's going to be the things we really look at for women in regards to libido issues is going to be, again, estrogen, testosterone. Guys, testosterone, believe it or not, if our estrogen levels are really low in the tank,
Absolutely.
can absolutely crush your
Mhm.
sex drive. And so guys don't know that. And there's a lot of
They don't realize
reasons.
they have to have it
Yeah.
too.
And for instance, myself, I can talk about, I've got to be on, I take a lot of zinc. And so
Mm.
for several different reasons, zinc is one of those things that can absolutely drive your estrogen levels in a tank, right? A couple of weeks ago, I was like, man, my joints are killing me, this and that. Just got some things going on. Don't know what's run my blood work. My estrogen level wasn't even reading,
It's not
right?
existent.
And
Yeah.
so you go, oh, as a guy, well, that's great. You don't want estrogen. Wrong, but big wrong, right? Estrogen's huge for guys in protecting our heart. And the other thing is for joint protection,
Joint
but again,
protection.
libido, right? It drives our libido as well, too. So hormones need to be kept in balance, right? Too much or too less of anything good is not a good thing. And so those are things that, you've got to look at. So, it's constantly fluctuating all the time, men, women, a lot of times it's a hormonal imbalance, but it isn't always hormonal imbalance. As we've talked, it could be cardiology issues. Have those things checked
You
out.
got to
Come
be
in,
checked
talk
out.
to us. Yeah, come in and talk to us. So we haven't gotten any more questions. So I think this is probably we've covered a lot today.
That's a lot of
Yeah,
information.
yeah. Thank you so much for being on here with us and
Thank
watching our,
you.
our live video. Any questions, please follow up again at our numbers 304-382-2080. Lori's.
681-781-9005.
We drilled it that time. We got it right. So again, hit us up on our emails, on the internet, wherever you can find us. Our office is located in Hurricane, West Virginia, 206 Chase Park. Easy to find there as well. We really appreciate it, guys. Have a great week.
Thanks
God
for your
bless.
time.
Thank you so much.
Bye.